All right, let's jump right in. Picture this. Your body, which is usually this incredible, self-healing machine, suddenly goes haywire. It gets its signals completely crossed. Instead of just healing a muscle after an injury, it decides to build bone there. Yeah, solid bone, right inside your soft tissue, locking up a joint. It sounds like something out of a sci-fi movie, right? But it's a very real, very strange medical mystery that has had doctors scratching their heads for more than 100 years.
So where does this story even begin? Well, we have to go all the way back to the trenches of World War I. French doctors started noticing something really bizarre in soldiers who had suffered these catastrophic spinal injuries. They saw that these men's bodies were forming new bone, but not on their skeletons. No, this was happening in the soft tissue, in the muscles around their paralyzed limbs. They came up with a mouthful of a name for it, but they had absolutely no clue what was causing it.
And that really is the heart of the mystery we're unpacking today. What on earth could make the body's own construction crew go rogue like this? Why would it start laying down bone where it has no business being? We're talking about something so aggressive it can literally build a second, unwanted skeleton that just freezes your joints solid. It's wild.
Okay, so before we can even start to solve this puzzle, we gotta know exactly what we're talking about. Let's put a proper name to this phenomenon of bone in the wrong place.
The official term is heterotopic ossification, or HO for short. And it's one of those fancy medical terms that actually makes perfect sense when you break it down. Heterotopic just means in the wrong place, and ossification means turning into bone. So there you have it, bone in the wrong place. And I want to be super clear here. This isn't some kind of cancerous growth. This is real, organized bone, sometimes with its own marrow, just growing wild where it shouldn't be.
All right, so the big question is, what kicks this whole thing off? What's the trigger? Well, it turns out it's not just one thing. There's a whole range of pretty intense events that can wake up this dormant bone-building process.
And this is where it gets kind of nuts. You might think this is a super rare condition, but get this. In certain high-risk situations, like after some major hip surgeries, the rate of HO can shoot up to 90%. Let that sink in. 9 out of 10 patients. That is a staggeringly high number for any kind of complication. And when you look at who's at risk, it's a really wide net. We're talking about everyone from soldiers with blast injuries, to patients getting a new hip or elbow, to people with traumatic brain or spinal cord injuries, and even folks with severe burns. You see the pattern here? The one thing that ties all of these together is massive physical trauma and the intense inflammation that comes with it.
So that leads us to the next logical step in our investigation. If the body is building bone, it needs bone-building cells, right? The builders. But where are they coming from?
I mean, it's a fair question. You might think, okay, maybe the body just sends its regular bone cells out on some crazy mission to the wrong job site. But the real answer, it's so much cooler and more complex than that. So here's the twist. The bone isn't being built by your standard issue bone cells. Nope. The culprits are actually a bunch of different types of stem cells that are already just hanging out in your soft tissues. You've got them in your tendons, around your blood vessels, even in your muscles. Their day job is to be the local repair crew for that specific tissue. But after a massive injury, something goes wrong. They get a bad signal, a mixed-up work order, and instead of patching up muscle or tendon, they start this bizarre transformation into bone-building cells.
Okay, so what is that bad signal? For a long time, researchers thought it was all about chemical signals from inflammation. But then they stumbled upon a crucial clue that pointed to something else entirely, a physical trigger. They call it the mechanical switch.
And this is the aha moment, the big reveal. It turns out the signal isn't just a chemical soup, it's mechanical. It's the actual physical force, the pushing, the pulling, the loading on that injured tissue that acts like a light switch. When those stem cells, already in a fired-up, inflamed area, feel that physical stress, they take it as a literal command. Drop everything. Start building bone right here, right now.
So how does this work on a tiny molecular level? It's basically a three-step process. First, you get that mechanical force on the tissue. Step 2, that force activates these key messenger proteins inside the stem cell. You might see them called YAP and TAZ in the research. These proteins then travel into the cell's nucleus, which is like its central command center. And then, step 3, they literally flip the genetic switches that shout the order to start building bone. It's a direct line of communication from physical force to genetic instruction.
Now, I know this diagram looks pretty complicated, but it shows something absolutely critical. That mechanical switch we just talked about, it's not a one-and-done thing. Think of it like the very first domino in a huge, elaborate setup. Once that first one falls, it sets off a whole chain reaction, a cascade of other signals that the body already knows how to use for bone formation. So that one physical nudge at the top starts a process that fully commits that cell to its new and very wrong career as a bone builder.
So, figuring out this mechanical switch is a massive breakthrough, for sure. But here's the problem. It also creates a huge, real-world dilemma for doctors and physical therapists who are just trying to help people heal.
And it really is the ultimate clinical catch-22. Think about it. After a major injury or surgery, what's the one thing you have to do? Physical therapy. You have to move the joint to get your function back and stop it from getting stiff. But wait, that very movement, that's the mechanical force that we now know can trigger this unwanted bone growth. So what's the alternative? Don't move it? Well, if you immobilize the joint to try and stop the HO, you're pretty much guaranteed to get muscle loss and a stiff, useless joint anyway. It's a terrible choice to have to make, and doctors and patients are stuck right in the middle.
And because of this impossible situation, the current ways of managing it are, well, they're a bit of a mixed bag. Doctors can try things like strong anti-inflammatory drugs or even low-dose radiation to stop it before it starts. But once that bone is fully formed, the only real option is to go in with surgery and literally chisel it away. And the cruel irony is that the surgery itself is another major trauma, the very thing that could cause the bone to grow right back.
So where do we go from here? Well, the mystery of unwanted bone isn't a total black box anymore. We have a prime suspect, that mechanical switch. And that leaves us with a million-dollar question. Now that we know about the switch, can we design a therapy to turn it off? Can we find a way to break the connection between the physical force of rehab and that rogue bone-building command? Just imagine a treatment that would let a patient go through all the physical therapy they need to heal without ever having to worry about waking up these rogue builders. Finding the answer to that wouldn't just be a step forward, it would completely change the game for trauma recovery.